Good evening and welcome everyone. Thank you, Hindi team. Uh, Today is our 1962nd day of continuous webinar. Thank you all for supporting us. And today's our guest is Dr. SAMIR CHAUKKAR. He's MD in Homeopathy. He's a Dean in Badras Academy and conducted a seminar in UK, Australia, New Zealand, Canada, USA, Malaysia, UK and Turkey. And he has a diploma in addiction treatment. He got PG from London and working and teaching experience for 10 years. And and he has conducted many seminar, international and national seminars, and conducted many classes all over the world. We are very happy to invite Dr. SAMIR CHAUKKAR. Dr. SAMIR, have you joined here? I cannot see. Doctor, you can speak now. Now you are the co-host. You're welcome. We already introduced you. I think there is no need of any introduction about you. You can start now, please.
Okay. How are you, Ajini?
Good, good.
You good? Okay. Good to see you after many days.
Yeah.
Okay. So how many people do we have now? We have around 20 people, right?
Yeah, people they'll join because
Is Dr. Dhanesh there?
yes.
Mhm.
Ganesh has joined.
Oh yeah, Dhanesh is there. Okay. Okay. So
Can start.
good evening, everybody. This is Dr. SAMIR CHAUKKAR. I'm the Dean of Dr. Batra's Academy in Mumbai, and today we're going to talk about role of homeopathy in autoimmune diseases. We see that every now and then nowadays we see that the autoimmune diseases are on rise, and every alternate patient that we see has some or the other problem which could be correlated with some autoimmunity. So first of all, we have to understand that what is autoimmune disease, what is autoimmunity, and then we can go into the role of homeopathy in that. You're allowing people, right? I don't have to do that, right? Ajini? Yeah, I cannot hear you.
Yes, sir. I'll
Yeah,
do that.
okay, because I'm seeing people
Yeah,
and I have to admit them
yeah.
every time.
You're seeing the
Okay, okay, okay.
no problem.
Okay.
I'll
So today we will talk about what is autoimmune disease, what is the role of homeopathy. We can talk about certain cases also, if time permits. Okay. So let's start with the presentation. So first of all, when we talk of autoimmunity, we have to know what is a normal immune response, which all of us know that whenever there is an invader like a virus or a bacteria, whenever it enters the body through any of the holes, we have this orifices of the nose or eyes or the ears or even GIT when we eat food or when we have injury. Always, whenever an invader, virus or a bacteria enters, the immune cells, there is always a local immune response and a general immune response. So immune cells called lymphocytes, they create antibodies to fight the invader. Okay. So we all know that there are T lymphocytes and B lymphocytes. One is a lymphoid immunity, one is a humoral immunity. All these things are known. So we know all that. What happens in autoimmune disease is that immune system creates antibodies that attack our own cells. Now we have to understand with the homeopathic perspective also, when we are unhappy with ourselves, when we are attacking ourselves mentally, physically, or emotionally in a way, the body also gets confused and there is a tendency to develop autoimmunities, which we'll talk about later on. Okay. So whenever a foreign substance enters, it starts resembling, okay, a bodily substance. The thing is that bacteria and viruses are also very clever. They know that how to mask. So they mask themselves in such a way that the normal body, kind of does not know that this is a agent that we have to fight, and this is a cell that we should not fight, and they start destroying our normal cells. That is what is autoimmunity, right? What are the autoimmune disease? What are the possible causes and risk factors? Now, of course, age often starts between 15 to 44. Gender, it affects mostly women. Of course, remember one thing, why women again? Because more stressful personalities, more sensitive personalities, bad effects of grief, bad effects of trauma are all seen in women, remember. So environmental, of course, chemicals, heavy metals, infections, stress, diet, especially the Western Mediterranean diet, all these things play a very, very important role. The processed food, the McDonald's, the burgers, the fries, and the pizzas and the pastas, these are the ones which are the causes, remember. Of course, genetics is most important. And another very important hypothesis is the hygiene, too much hygiene. Now, remember when we were learning atopic dermatitis or even eczema, which it is known as, too much cleanliness also can raise to autoimmunity, because many a times when we are exposed to allergens every now and then, there is a chance of normal immunity being developed. But when we are too clean, and when we manage everything very, very cleanly, so much so that we are obsessive about cleanliness, there are chances of an infection, remember. So that is the over clean hypothesis or hygiene hypothesis, just like vaccines and antiseptics, remember that. Now there are around 80 autoimmune diseases, but the commonest are, of course, multiple sclerosis, which we see, of course, type 1 diabetes, then celiac disease, Addison's disease, Guillain-Barré syndrome, and vitiligo is there, psoriasis is there, atopic dermatitis is there, all these, many. Of course, the Graves disease and Hashimoto's disease also of thyroid. So there are 80 diseases, remember, and they are on the rise, remember. Now, types of autoimmune, just now we talked about overactive immune system is the cause, remember, and therefore one of the commonest treatment that the contemporary doctors give is immunosuppressants. They suppress our immunity, but ultimately it is bad, because then we can get opportunistic infections also when you're suppressing your immunity, and that is the only treatment which is available in autoimmune disease. So methotrexate or strong drugs are given in order to suppress the immunity. So type 1 diabetes, Hashimoto's disease, rheumatoid arthritis, very, very important. Sjogren's syndrome. So I have cases of rheumatoid, I have cases of Sjogren's also, which I will discuss later on. Psoriasis, celiac disease, systemic lupus erythematosus is very, very important. Something that affects not only individual organs, but many a times these autoimmune disorders can affect the whole of the body and lead to a lot of debility and tiredness. Remember that. So, an autoimmune disease is a condition in which the immune system, which normally guards us against germs, fails to differentiate between self and non self. This results in production of antibodies which damages the healthy tissue. Something similar to chemotherapy. Remember, when you are doing chemotherapy for cancer, you are not only killing the abnormal cells but also killing the normal cells also. That is what is the bad effect of chemotherapy. So, something similar to hypothesis here. Autoimmune disorders are one of the most complex and difficult diseases to treat, but this is allopathic. Remember, all this comes from allopathy. They feel it is difficult, so but it's not difficult for us. Remember, we as homeopaths, we can treat autoimmune disorders. Some autoimmune disorders are life-threatening, and the rest are immune system debilitating, which require a lifetime treatment. There are treatments available to reduce the symptoms and effects in many autoimmune disorders. Now, this is a very important line. There are treatments available to reduce the symptoms. So there is no curability. There is only reduce the intensity of symptoms, or known as palliation, and effects in many autoimmune disorders. Again, says that not in all. So still there is a lot of autoimmune disease where there is no treatment at all. You can give steroids, you can give methotrexate, but the condition goes on debilitating and progressing. It is an immune system condition where body mistakenly attacks its own healthy cells and tissues. This occurs when the immune system fails to distinguish between self and non-self. Now again, remember, if you know, there is a rubric called antagonism with self. In the repertory, there is later on I'll be also discussing some rubrics which are similar to autoimmunity. So autoimmunity and the rubrics in our Materia Medica will fall in place. Remember. Autoimmune diseases are not contagious but have multifactorial cause involving genetic, hormonal, and environmental factors. Okay, so this is the same thing. In autoimmune disease, the immune system mistakes, we have already seen, and mistakes the normal cells as foreign cells. Now, they could be in the joint if it is rheumatoid arthritis, it could be skin if it is SLE, or any organ. It releases proteins called autoantibodies that attack healthy cells, resulting into autoimmune disease. Some autoimmune diseases target only one organ, like type 1 diabetes will damage the pancreas. But disease like systemic lupus erythematosus will affect the whole body, including the skin. Remember that. As there is a autoimmunity at physical level, now this is something which is very, very important. It can be preceded by autoimmunity at the level of mind, remember. As we always know that the first the psyche is affected and then the body is affected. So even in autoimmune disorders, first the mind is affected. There is autoimmunity at mind. What do you mean by autoimmunity at mind? That means when you start self-reproaching, when you become so guilty, when you start self-reproaching, when you start condemning yourself, when you start abusing yourself, then this process starts. If the autoimmunity at the level of mind is understood, the homeopathic treatment can be made in ease. Common causes are failure of immune tolerance, the body's mechanism for eliminating or suppressing self reactive immune cells fail, genetic predisposition, which is a common thing again, environmental triggers like viruses, bacteria. So, again, when we are talking of autism, we talk that there has to be a genetic predisposition, then there has to be an environmental insult, and then there will be autism. So only an environmental problem will not cause, only genetics will not cause. There has to be a combination of genetic predisposition and virus bacteria, then only you can get a, but of course there has to be a ailments from, and that's where homeopathy is important. How does this problem start? Since I failed in the exam, since my wife died, or my father died, my grandfather died, my pet died, there was a divorce, then I wanted to become a doctor, but I could not, I failed in the exam, or I did not get enough marks. This is the ailments from which is very, very important. If you as homeopath catch these ailments from our repertory, I think we can treat any and every problem. Remember that. Okay. These are the common types. Rheumatoid arthritis, a chronic inflammatory disorder affecting bilateral symmetrical small joints of the hands and feet. Remember, that's the basic differentiation between rheumatoid arthritis and osteoarthritis. Osteoarthritis is a wear and tear problem. It is an aging problem. Rheumatoid arthritis is in young people, especially females, and the problem is in the morning when they get up, there is a lot of stiffness, and the patient will typically speak of Restock's modalities, that when I get up, it is very, very difficult to move, but as soon as I start moving, I feel better. That doesn't mean that you give Restox to everybody, remember. Because Restox has similar modalities like Calcareflor also. Calcareflor is yet another remedy which is very, very similar to Restox. So it's very, very important to differentiate Restox from Calcareflor, because mentally both are absolutely different. One has anxiety for the family, one has anxiety for money, remember, which is very, very important. Celiac disease, it is usually by eating gluten. Remember, most of the problems today in today's world are because of gluten and sensitivity of gluten and something called leaky gut syndrome. Remember, gluten, when we eat the chapatis and the maidas and the pizzas, what we eat, usually people develop hypersensitivity to it, and these autoantibodies, they enter into the intestinal mucosa and they travel up to even to the brain, and they can lead to autism. Remember that. So a gluten free, casein free diet is very, very important in many of the autoimmune disorders. Remember, Sjogren syndrome, again, dryness. It is characterized by lack of moisture and dryness. All the mucus secreting, even all the secretions which are, for watering of eyes, for our, skin to become moist, all these thing is lost. There is no moisture left. But remember, no moisture left in the life, no moisture left in the body. So you have to correlate that. I had a patient who had Sjogren syndrome, and she was treated very, very badly by her in-laws, very, very badly by her mother. So much so she thought of committing suicide. Absolute dryness in the life. There was no moisture. By moisture and dampness, we mean that we need, oxygen. We need water for survival. What if there is no water in our life? What if there is no moisture in our life? That is what is Sjogren syndrome. And I had given her pulsatilla. Can you imagine? Pulsatilla really worked for her. Pulsatilla was typically a dry remedy without us, and she was typically a pulsatilla after this wronged feeling. So Sjogren syndrome, remember, it's a very, very important thing. Polymyalgia rheumatica, again an inflammatory disorder, muscle pain, stiffness. Also the fibromyalgia or chronic fatigue syndrome that nowadays is so fashionable. Everybody is diagnosed as chronic fatigue syndrome. Remember that. So many people are coming with the chronic fatigue syndrome. Multiple sclerosis, where the sheath of the neurons is a problem. There are autoantibodies against the myelin sheath, protective covering of the nerves. Ankylosing spondylitis, another debilitating disease known as bamboo spine. Remember, the spine becomes like bamboo. Normally, our spine is very, we can actually move ahead, go on the side. These people, they are एकदम straight. Their spine becomes straight like a bamboo, like a railway track. Remember. In belly spur, in Allen's keynote, if you see, there is something called belly spur railway spine. Remember. Allen writes railway spine, and that is ankylosing spondylitis. Remember that. Type 1 diabetes, many children nowadays. I visit Turkey and I see so many children, young children of 4 years, 5 years, 6 years having insulin shots. Why is this coming up? Chronic condition where pancreas produces no insulin at all. Alopecia areata, one which is very common nowadays, again autoimmune disorder. Applying any oil or any thuja will not help, remember that. For every hair fall, thuja is not good. For every hair fall, we cannot give medicine. You have to find out the cause. Remember, alopecia areata, shiny coin shaped patches of baldness. Remember, very important. And one of the most important remedies that we give is fluoric acid. And 99%, believe me, 99% you'll have results with fluoric acid in alopecia areata. One of the three mark remedies in patchy loss of hair in Kent's repertory or any other repertory, you see fluoric acid. If you give twice or thrice in a day for 15-20 days, surely the hair will come. 1%, of course, there is a chance, but 99% I have seen that fluoric acid works wonders. Remember that. Vasculitis, yet very common inflammation of blood vessels that causes changes in the blood vessels. Now, what are the homeopathic causes of autoimmunity? We looked at the contemporary causes. We looked at how genetics and how bacteria and virus, all these can cause autoimmunity. But we have to look at something before this, and that is how homeopathy is better than allopathy, because allopathy looks at only one thing and then goes ahead with the symptoms, diagnosis, treatment, and management. It doesn't say why genetics, why this person is affected, why this person only is affected. This is very important. So prolonged suppression of emotions, that's a very clear cut indication of autoimmunity, and this is a clear cut correlation between autoimmune disorders and prolonged. Now prolonged is very important. You don't get an autoimmune disorder overnight. You don't have problems or emotion just now, or somebody dies and you suddenly get. No, it is not like that. Yes, you can, depending on your susceptibility, but normally people don't get. They'll get after a span of 5 years, 10 years, and that's when they go to the doctor, and the doctor is not going to understand that. The allopathic doctor doesn't give importance to death of mother or death of father. He's not going to ask whether you failed and you did not get in MBBS, you had to go to homeopathy, but that was a profound disappointment for somebody, and somebody developed ulcerative colitis. One of my patients, she developed severe ulcerative colitis after she could not go into MBBS. She studied so hard, she went for MBBS, she went for everything, but could not get the enough percentage. And that disappointment led to all this. So, deceived ambition, ambition deceived is a very important thing. And prolonged suppression of emotions, prolonged, long lasting grief. What happens in Ignatia, the disconcerted feeling. She keeps on dancing for others at the tune of others, wants to help others, sympathetic, but she doesn't want to do anything for herself because she's coward. Cowardice with no opinion of herself. So she will do things for others, and people are just taking her for granted, and that's how she goes into a profound disconcertedness. Okay. Wrong suffered, very important. Our naja, very important remedy. Snake venoms are very important for autoimmunity, remember, or even blood related disorders. So ailments from being wrong suffered or wrong treated, abuse in life, ambition deceived, suppressed anger, suppression of emotions, fighting against self. Why I am doing this? I am wrong, I am bad, contemptuous of self, self abusing, self guilt, too much guilt inside, too much blaming yourself that okay, it all happened because of me, I am bad, I should not have done that. Look at aurum metallicum, look at all metals and minerals for autoimmunity. Remember, less of plants but more of minerals, more of animal kingdom, because of the low susceptibility, because of the affection of the nervous system, because of the blood vessels. You have to look at deeper remedies. You cannot give very superficial acting remedies here, remember that. Symptoms are very common. I mean, they will come up with very common symptoms like flu, remember, like fatigue, joint stiffness might be there, joint pains will be there, tired feeling will be there, some skin rashes here and there, hair loss, low grade fever, weight loss, dizziness. Initially, maybe 15, 20 days, even months, you will not be able to diagnose a autoimmune disorder because it may always mimic a viral disease or a bacterial disease. You may do all sorts of blood tests, but you may not get the exact blood test until unless you do something called C reactive protein, remember, which is the most important investigations, what is called CRP, very important. And of course, the second important is auto antibodies or auto antigens or auto antibodies, the tests which are done. might require anti DNA tests and antibodies tests and all that. No definite cure, but you can manage symptoms and control the condition. Common treatments are you give vitamin supplements, hormone supplements, physical therapy, physiotherapy for bone, joints, muscles, blood transfusion for blood related, and of course steroids and methotrexate and all heavy kind of medications which have lots and lots of side effects. Remember that. In homeopathy, there are many, many medicines which can treat autoimmune disorders if similimum is prescribed. Repertory plays a very, very important role in treatment of autoimmune disorders because it has plenty of rubrics along with clinical rubrics related to autoimmune disorders. After going through these specific rubrics, one can certainly meet with the most similar medicine. Now, today we will first talk about a disease which is the most commonest. You will see every second or third patient with rheumatoid arthritis nowadays. Now, remember, joint means mobility, whatever joint it may be. Most important is the joint function is mobility. When your mobility is stopped or when your mobility is restricted, you will get some joint problem. Remember that. Now, which joint is affected, that is important. Whether your back is affected, whether your neck is affected, lower back, middle back. If you read a book by Louis Hay, you know what is the psychodynamics of joint pains. Remember, now if your knee joint, what is the main function of your knee? Your main function of your knee is to support your body, number one, and also movement. Now imagine somebody's movement is restricted. What do you mean by movement? Movement means I wanted to do this, but my husband did not allow. I wanted to travel. I wanted to go to the Ganges. I wanted to go to Vaishnav Devi, but my husband did not allow me. He said, "No, no, don't go." We were all supposed to go, all women trip was there. I wanted to go out, I wanted to travel with everybody, but my husband did not allow me. What happened here? There is a restriction of mobility, and when you are restricted, you will get a disease that will restrict your mobility more. Remember, that is how psychodynamics works. You will say that, okay, I want to move, but I am not able to move, so you will get a disease that will affect your movement, and that is what is rheumatoid arthritis. So rheumatoid arthritis is one of the most common autoimmune disorders throughout the world. Here the important rubrics of RA are given, which will be helpful to find out a short group of similar medicines. Then similimum can be selected with the help of materia medica. The main treatment for autoimmune disease is with the use of medications that bring down the inflammation and calm down the overactive immune response. I don't exactly believe this because our similimum will do that. We don't have any specific medicines that will bring down. We don't give belladonna or aconite or ferrum to reduce the inflammation and calm the overactive immune response. We are giving constitutional remedies. Constitutional remedies only will work. Remember, not that they will only work. You might have to give some local remedy here and there to allay the local symptoms also. You might have required to give a nosode, you might require to give a bowel nosode, but a constitutional remedy will be the mainstay of treatment. That is the most important thing. Okay. Autoimmune response at the level of mind before the disease onset. Remember, autoimmune response at the level of mind before disease onset plus mental state after the disease onset plus some characteristic symptoms is equal to similar. Okay, so first find out whenever the patient is right in front of us, I am going to ask him ailments from that. Tell me, when did this start? What was your condition at that time when these joint pains they started? Did there was there a fight? Was your mobility restricted? Did you want to go out anywhere? What exactly happened? And again, important thing is always ask questions which are related to everything around us. Don't ask too many vague questions. Ask what is the problem in the family. Ask what is the problem with your friends. Ask what is the problem in your office. These are the only three interpersonal things that we are concerned with. Remember that. And you will get problems here only. Remember, exposure to cold or having cold drink is never the cause. It may be the precipitating cause, but it is never the fundamental cause. Remember, drink cold drink and ice cream can cause tonsillitis, but why? Why is cold drink causing tonsillitis? Is our answer or is our question that we have to delve into. Not the cold drink leading to tonsillitis. The remedy you give, it will act for 5 minutes. But what is the difference between allopathy and homeopathy then? We have to say why this person, when he drinks cold water, is getting tonsillitis. So find out the cause behind the cause, which is very, very important. Sizet effector, Sizet causa, or Sizet causa, Sizet effector. This is what Hahnemann said, right? So in case, so first of all, find out the level of mind before the disease onset. So find out the individualistic attitude. How are you as a person? Tell me. Not now. After the disease, don't tell me how you have become. Maybe you have become irritable now. But are you basically a person like that? No, I am not a irritable person. I am a very congenial person. I like to mix with people. I like friends. I want to have friends. But since I got rheumatoid arthritis, I have become very irritable. So try to find out the level of mind before the disease onset, mental state after disease onset. Try to correlate both of them, because your remedy should cover both the states. Remember, if your remedy only covers mild state of a remedy, your remedy will not act. You have to have the mild as well as the irritable state. So go back to the source books, find out whether your remedy is covering both the states. Remember that. So before my disease onset, mental state after disease onset, and look for PQRS. As in 153 Hahnemann says that don't look at the common symptom, don't look at the joints. My joints are stiff in the morning, so don't take aggravated morning in rheumatoid arthritis, because it is a common symptom of the disease. Find out the symptoms of the person or the patient and not the disease. So don't look at stiffness in the fingers in the morning, I feel better by moment. Don't give rest talks to every patient. Why you develop this is very very important. Okay, that is your simillimum for autoimmune disease disorder. In case of a congenital autoimmune disease, pregnancy history is very very important. If a child is born with cleft lip or cleft palate or some ASD or VSD or whatever, most important thing is the mother. Remember that. If you want to treat this child, ask the mother what was her state during pregnancy, and that will be the only and only indication for the remedy for the child. Remember that. Of course, the child might have its own characteristics, a few here and there, but in a newborn child or 1 to 3 month child, you are not going to get too much of characteristics, right? So the pregnancy history and the maternal stress and autoimmune response at the level of mind during the time of pregnancy helps in finding out the symptoms. So you need to know what is required, what is the kind of case taking which is required in autoimmune disorder. Remember. Now, if you look at symptoms of RA, you can look at rheumatic pains. In now, what is the symptom? Common pain is rheumatic pain in joints of the finger. So you look at the synthesis repertory, extremities, pain, fingers, joints, rheumatic. Okay. If you see in the repertory of symptoms, you see fingers, pain, joints, complete repertory, again, extremities, pain, upper limb, finger, joints. Fever, many a times rheumatoid arthritis is fever also. So extremities, pain, fever during, joint pain, fever during, pain in small joints. Again, we have a rubric. Now remember, again, taking these rubrics will not really help you. Yes, they'll help you as far as localizing the remedy or finding out the remedy. But your remedy should not only cover the local symptoms, but also the particular symptoms and the general symptoms and the mind also. Remember that. If you give only looking at the repertory symptoms, then you will come only to Rustox, Magfos, Calcareflor, all these remedies. But your remedy has to cover the mental state also. What mentality has changed? How is he changed mentally? My husband has become very irritable now. He wants things in place. He's become very, very fastidious. He gets very, very angry if things are moved from. He was never like this. This is important. What does Hahnemann say is deviation from normal. In the organon, he says, look at how he deviates from the normal, and that will lead to the characteristic. Remember. So, pain in small joints, stiffness of the joints. Again, generals, stiffness of the joints. It is given in generals, remember. In complete repertory, it is given in extremities, stiffness, general morning. Inflammation of the joint, extremities inflammation, joint synovitis, joint synovia, hard nodular lumps present, so extremities, nodules, fingers, hard nodular lumps present in joints with deformities. So with deformants, nodosa deformans. If you see in the repertory, nodosa deformans. Stiffness of the joints is there in generals also and in extremities also, in two different repertories. What are the rubrics which are directly related rubrics in Murphy's repertory? Now, in Murphy's repertory, which is typically for, it is known as a medical repertory. Remember, the heading of the repertory is medical repertory, which means everything is very, very medical in that, just like a MBBS. For a MBBS person, it becomes easy because they don't have to learn repertory, they have to just look alphabetically. So, you see, Addison's disease given directly, remember. Alopecia areata is given in constitution, hair, general head and body, loss of hair from the head in patches. Ankylosing is given directly as ankylosing spondylitis. Now remember how useful is this? We'll have to see ourselves, because when you're looking at a constitution, when you're looking at the generalities, when you're looking at a person as a whole, these rubrics, yes, if my remedies maybe Rustox, XYZ Rustox, and then if I see in the rubric ankylosing spondylitis Rustox is there, I am happy. But if it is in the rubric ankylosing spondylitis and generally the patient is not covered, I will not like this rubric. I will not take it. Remember that. So from generals to particulars is a very, very important thing. Don't go from particulars to general. Very, very important. Autoimmune hepatitis is given as hepatitis. Celiac disease is given celiac. Crohn's disease, endometriosis, fibromyalgia, which is given as muscles, pain in the muscles. There is nothing like fibromyalgia given in the repertory, but muscles. Glomerulonephritis, disease, nephritis, kidney, Graves' disease, glands, thyroid, gland remedies goiter, hemolytic disease, juvenile diabetic mellitus is given. So that your juvenile is not given, but diabetes mellitus and diabetes insipidus is given. Lichen planus is given. Meniere's disease, multiple sclerosis, myasthenia gravis, pemphigus, psoriasis, scleroderma. So these are the rubrics which are given directly in the Murphy's repertory, but don't get misguided. Remember, always go from the person to the repertory, not from the repertory to the person. Remember. The main treatment for autoimmune diseases is with the use of medications that bring down, which we have already talked about. Prognosis should be assessed based on Herring's law of cure. Remember, once you know, ask how the person was affected, right, in a chronological order. Because when you give the right remedy, it has to go from above downwards, within outwards, more vital organs to less vital organs, and in the reverse order of appearance of symptoms. So, Herring's law of cure will tell you the prognosis of the case. Remember that. Now, I was talking about the autoimmune rubrics in Murphy's repertory. Now, remember, as I told you, when you start going against yourself, you know that you belong to you. Remember, you know that you belong to yourself. But when you start thinking what you're doing is bad, when you start thinking what you're doing is wrong, what you're doing is not right, what you are doing is hurting others, you start blaming yourself, you feel guilty, being very, very guilty. That is the beginning of autoimmune disorders. Remember that. So, one of the most important rubrics is anger with himself. When you're feeling strongly that you have done something or have done or not done something and you are unhappy with your own self, no, no, oh shit, why it happened? Why did I do that? I should not have done that. This is the time when you start hating yourself. That's why so many learned people tell you that love thyself. Okay? Start loving yourself. The day you start hating yourself, the day you have done something wrong, the day you start feeling guilty, the day start blaming yourself for something that you have done or not done, that is the time something is going to start. Either autoimmune disorder or a cancer, remember. Very, very important. Antagonism with herself. Am I doing right? Am I doing wrong? Maybe I should not have done that. Maybe, oh, something in me says don't do it. Something in me says do it. So, antagonism is a hostility that results in active resistance, opposition, contentiousness, a kind of struggle against one life. That is what happens. Why should ourselves become our own enemies? Remember that. Why should our cells attack our own cells? Because we are attacking ourselves. Remember that. We, as a whole body, which is made of trillions of cells, our body, our mind, we are attacking ourselves. Why not the cells will do that? Cells will also obey what our mind says. Remember that. So look at the mind, how the cells are being dictated by the mind. Remember that. Aversion to himself, a strong feeling, oh, I don't like myself. Remember a remedy in batch flowers called crab apple. A very, very important remedy that I use with this kind of sensation. Oh, I don't like myself. I am not good enough. I have got acne. I don't look good enough. I have got this, my height is not so good. I don't like myself. When I go in public, I hate myself. I don't have confidence. I hate myself. The day you start saying you hate yourself, the body starts hating you. The cells start hating you and they start multiplying inside and fighting with each other. That is what is autoimmunity, remember. A strong feeling of not liking yourself, blaming yourself. The patient feels that he or she is responsible for something bad as that happened. I have done something bad. God will punish me. So Kali Brom, remember, as if she is a vengeance of, as if she is a target of God's vengeance. Kali Brom, very, very important remedy. Remember that. Contemptuous of oneself, lack of admiration of oneself or state of putting oneself down. Remember that. Self depreciation, a very, very important rubric. Remember, self depreciation. Don't forget this rubric, self depreciation. Delusion that he has neglected his duty. Patient feels that he's not done his duty. Ignatia is there, aurum metallicum is there. Important remedies, and that's where, remember, aurum metallicum again a prime remedy for autoimmune disorders with that kind of personality. Remember, delusion that he's done wrong, which he's not supposed to do. discontented with himself. Oh, I want this, I want that, I'm not contented, I want that also, I want this also, I want this also. So greed, discontent, mutilating his body, inflicting a violent and a disfiguring injury on his or her own body. Remember, many, even an acne which is there, and you try to trick it out, or even a psoriasis patch, and you're scratching it very hard so that it starts bleeding. Again, it is mutilating your body. Remember, what you're doing is acting against the nature, acting against your body. Dead desire. Oh, I should have died instead of this. I don't know why I'm alive. This statement itself is very, very heavily loaded. Remember that. When you talk of death, when you talk of destruction, something changes in the body. Remember, the chemistry changes in the body. Remember that. Hard hearted, not being sympathetic to oneself or being in a state of unfeeling, hurting himself, indifference to himself, injuring himself, kill desire to, sudden desire to kill herself, masochism, derivation of sexual gratification from being subjected to physical pain or humiliation by oneself or by another person. Again, masochism could be a wife who's just bearing her husband. Remember, it's not always about sex or it's not about sexual gratification, but saying that, oh no, it is my duty to be a good wife, let him beat me. What happens to a typical wife of an alcoholic? The alcoholic will hit her, beat her, black and blue, but she'll say, no, 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 it's okay. I have seen women when I was an addiction counselor for 10 years. Uh, we used to see women of husbands who are alcoholic, and they would say that I am so used to beating by my husband that I feel this is the only way he shows his love. Remember that. So much pathological they are. And one day if the husband doesn't beat her, she feels, oh, has he got another woman? Maybe he's interested in another woman, that he's not beating me. This is the typical codependency which you see in addiction. Remember that. So these are the people who will go into thyroid, remember. So you see so many women with thyroid problems, Hashimoto's disease, and this is the feeling. Maybe he doesn't love me. Maybe he blames me. False blame. Blaming. Maybe I am not good enough. My husband is going to another woman. Maybe I am not good enough. And then she starts developing thyroid problems, remember. So this is very, very important. Why autoimmune disease starts? Indifference, injuring, masochism, we already talked about. Neglecting himself. I will look after my children. I don't want to look after, I don't want to eat anything. Like our typical Indian females, let everybody eat and whatever remains, I will eat. This is again a typical Indian attitude. Remember that. Indian women, they will eat at the end after all the males have finished their dinner or lunch. They'll give everything to their children. Last one roti also they'll give to their child. I'll say, no, 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 I am not hungry. I will just take milk and this is a typical sacrificial, goat. What is a Indian woman like, right? Most women. So failure to take care of herself, loathing himself, disliking yourself, hating yourself, reproaching oneself, remorse. Again, you're sad for what you have done or not done, but you're sad. You feel as if you have done something great mistake and going into guilt. Suicidal thought, suicidal disposition, both very, very important. Self-destructive thoughts of self-destructive behavior. I should cut myself. I feel like killing myself with a knife. No, you're not killing, but you already killed yourself by talking this. Remember, when you talk, when that only the talk or only the words kill you, and inside the cells they change. Remember, when you talk, self-deception, an act of lying to oneself. No, no, I am happy. No, no, no problem. My husband beats me every day, but I'm still happy. My child doesn't respect me. My child is rude to me. He doesn't listen to us. He's disobedient. So many complaints, but he's okay. He's my good child. No, no problem, no problem. Everything is okay. Saying that everything is normal when everything is not normal again is a problem. Remember that. Self abuse, self accusation, self assertion, want of, like we see in Ignatia. Cowardice, no power for her own opinion. Remember, the person lacks the act of asserting oneself or one's own rights or claims or opinions. Self blame, blaming self, striking himself, tormenting himself, thoughts tormenting. These are the rubrics which are autoimmune rubrics. Remember, now this is some new concept that I came across, so I wanted to share with you that these are the rubrics which can be autoimmune rubrics. Remember that. I'll talk of a case. Okay. Case of a trapped woman. Okay. Now, this is a case. Now, why I have called it a trapped woman? Because again, there is lot of suppression of emotions. Okay. So, a 35-year-old woman from Ankara, Turkey, came to me in May 24 with attacks of severe migraine once or twice in a week, now increased to more or less every day. The migraine is usually on the left side, starts in the morning, goes till sleep, and is better after sleep, but the dull pain remains. She was also diagnosed with UC or ulcerative colitis and is on Misacol, high dosage with steroids. Every time she is stressed, she gets blood in her stools and severe pain in the stomach, better by doubling up. Now, when you look at so much history, you think, okay, she's migraine, she's got bleeding in the stools. Let me give her some Merxol or some Polosynth or Magfos for doubling up and all that. But this is not so easy. Remember that. When I asked her, tell me something about you, she said, I am a highly educated woman. I have done my engineering and MBA and working with the government before my marriage. She was very, very ambitious. She was on a top government post. She has been a ranker performance since her childhood. Everything was okay till she got married. Now, this is the time what triggered everything. And I asked her, what was the time when all these things started? It started after my marriage. What happened after your marriage? Her husband is also an engineer. In fact, they met at the same office and they fell in love. They got married. Very, very dominating and abusive by nature. He was not like that before. Remember, when I asked him, was he like that before when you were dating him or when you were with him? No, no, he was very nice. He used to listen to me. The day we got married, I could see the real face of this man. He's very dominating and abusing by nature. Immediately after marriage, he wanted her to leave the job, which is very, very typical, especially in certain communities where they don't want their wives to work, even if they're at a high position. Now, this lady had worked so hard and she had studied so hard and she was always on the top ranker and she reached to a very, very top position at a very, very young age in her life. Remember that. But immediately after her marriage, the husband said, you have to leave the job and look after his ailing mother who had a dementia. She said no at first, but as she was in the prime of her career, earning double of what her husband was earning. But ultimately, she had to succumb. She also got pregnant, and after pregnancy, she had to leave her job against her wishes. Now, pregnancy was also forced on her. She did not want to become pregnant. The husband somehow forced her into pregnancy, and she got pregnant at a very early age, immediately after the marriage. Because somehow or the other, probably the husband really wanted her to be at home. So he used maybe one of these ways. Many times she said that she felt trapped in this marriage. Now, something which is persistent, predominant, and coming again and again in the case, forming a pattern. What I could hear when my eyes were also closed and when my ears were open was that she was saying that I feel trapped, I feel trapped in this marriage. And therefore, I named this case as case of a trapped woman. Now, a very, very successful woman, top of her career, now made to sit at home doing household chores, which she was never supposed to do, which she never did at her mom's place. She's doing all those things and she's feeling, what am I doing here? Okay. But she's still continuing doing that. Remember, she feels it is her duty, it is a responsibility. I know this is not for me, but since I am a wife of this guy, I am the daughter in law of this family, I have to work. So I feel like all my life has gone to our last meeting was 21st July. You gave me, I had given her ferrum and carcinosin, of course, CA is carcinosin because too much responsibility she was taking, and she told me about her childhood. Typical carcinosin, also colicin during a flare up. Ulcerative colitis started last July and flare up in September. It was going to heal, but it is not over yet. So, carcinosin gave me some response, but it was 45-50%, and I was not happy with it. I raised carcinosin to even 1M and LM potency, but it did not work. I think it is getting worse before responsibilities start. It started getting worse in December, September. By the way, I think my anger towards the past and my family members has decreased. I guess I am a bit more neutral now. I am actually happy, just very tired. I am alone with the kids. My son's school, homework, course, emotion, and my baby doesn't stay on her own for even a second and is demanding every moment. I have become very absent minded and forgetting things. Honestly, I am also afraid of becoming like women in my family who have Alzheimer's or dementia. I used to be very smart, full of ideas, quick at finding solutions, and an easy learner. But now my mind feels scattered. Of course, it could also be because of tiredness. So there's a lot of, she's trying to be objective about why I am like that. So objective reasonable is one of the rubrics that I thought of because she was trying to explain all these things in a very rational manner. My husband thinks I am tense and sometimes criticizes me. He's usually not at home. Taking care of my children is hard, but I know it is temporary and I love them. So she is basically loving character, basically a responsible character. Okay, she's not like sepia who will go into indifference. That's why this remedy comes very close to sepia but goes away from sepia, because sepia will become indifferent. She'll become indifferent to the husband, she'll become indifferent to children, she'll stop working, she'll rebel. But this lady is not rebelling, she's doing everything like a duty, remember that. Okay, so that is where you differentiate between sepia and this remedy. Taking care of my mother together with my children is very exhausting. I'm afraid so and so letting okay, I feel like it is my responsibility to solve everything. This is an important thing. I feel it is my responsibility to solve everything at home. By the way, I used to be very social, but being at home for 2 years has affected. Now, don't you feel like she's jailed somewhere, right? She's in a jail. When she said that I feel like trapped, she was flying, she was free, and suddenly she was put in a jail and kept there. And that's where we think of the remedy. That remedy has to do something with flying, the remedy has to be something doing that it has to be captivated somewhere or kept it inside somewhere, right? In a jail. When I took carcinosin, I usually have intense dreams for 1 week. My ulcerative colitis never fully stops. My mother has Alzheimer's, mental ability. Some days she's better. Okay, I take care of my baby and my son. Because of this, I feel trapped at home. So again, the pattern is coming. Trapped, trapped, trapped. I blame myself a lot. Remember, I talked about autoimmunity and blaming yourself, talking to yourself, blaming yourself, guilty, too much responsibility, too much self depreciation. I often criticize my motherhood also. I try to be perfect, but I cannot be perfect. When I get angry with my child, I apologize too much and explain again and again. See this. Again, the same thing that we are trying to see how autoimmunity develops. Why in this lady autoimmunity developed? Actually, I am not unhappy in general. I am grateful to what I have been, but I am always anxious. What if something bad happens? So we see the case analysis here. What do you see? That she's a highly ambitious woman. She's an achiever and performer. She always wants to be on the top, rises to the top very fast. Now you have to look at a a living being which is maybe at a level and then rises very, very fast in the air. Okay, at around 300 or 350 kilometers per hour. That is the speed of this living being. Remember, ability to fly and achieve with ease feeling, but yields to the pressure of home. This is what she did. Ease feeling, छोड़ दिया easily. A big career, lots of money, car, bungalow, everything left very, very easily. Ease feeling of is a rubric, remember that. Ease feeling of. Dominated by home, she's always available for family and is taken for granted. Responsibilities and home people pull her down. Somebody who's flying at a very high speed, pull them down and captivate them. Feels trapped and feels present. Okay, so what could be the remedy? Anybody in the group? Yes, Ajini, any remedy? There are a lot of people, so we need to. I'm happy that there are many, many people today. Maybe they did not know that I am there. So, okay. So, what's the remedy? Anybody? We had one senior gentleman. Ram Pravesh ji. Okay, Jolly. Yes, please, sir. Jolly has raised a hand. Can you unmute him? Ajini, can you unmute Jolly? Yes, sir. Jolly PS. Yes, sir.
Naja,
Huh?
Naja, Naja.
Naja. Okay, why Naja?
Okay.
Could be Naja. Yes, Naja is very, very
Because
close because of a
uh,
wrong feeling. Yes,
just like
yes.
snake in a glass bottle want to bite, but cannot bite. Is it, sir? An opinion only.
Yes, yes, you're right, ma'am. Even I thought of Naja many times because of the nobility of the
Because
cobra.
just like a snake in a glass bottle, the snake want
Yeah.
to bite, but he cannot. So
Okay.
with that helplessness of a snake,
Okay. The
can
main
he?
feeling of Naja again, ma'am, is a wronged feeling. Okay. This is very much in this case delusion that she's wronged. A very, very important thing. So, ma'am, it's a very, very good thing. I also thought of Naja, but then there is still one more aspect of this, that she's very, very highly ambitious. Remember, Najas, you don't see this highly ambitious, high performers. Remember, you're looking at a very, very high. Snake is on the ground, right, madam? We are thinking of something in the
Okay.
mountains, in the Himalayas, on the mountains.
Oh, oh, oh.
So there has to be a
Okay,
difference
okay,
between
okay, okay.
snake is never in the Himalayas, right? On the Himalayas, what do you see? A very, very high flying. And if this high flying bird is taken
Okay,
down,
okay.
what will be? Okay, so but it's a good try. Even I thought of it. So we are looking at this living being. Okay, we are also known as
Oh,
peregrine
okay.
falcon or falco peregrinis, right? A very, very important remedy of today's age. Remember, today's age, all the ladies are uh, on full force and they are really, working hard, struggling to reach to the top. And because of their abilities, they are reaching to the top. But once they get married, they come into the same household, into the same traditions, and many households are so backward in thinking that they, no, 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 my daughter-in-law will not work, my wife will not work because it is the ego of the husband. Remember, my wife will sit at home and she'll take care of children only, and this is what is giving a lot of autoimmune disorders. So it's not important what you're treating, whether it is ulcerative colitis or Crohn's or rheumatoid arthritis. It is not important. What is important is what are they subject to and what are they developing. That is very, very important. So peregrine falcon, which is the first remedy, which is proved by Misha Norland. Now he's no more with us, but a excellent gentleman, excellent homeopath from UK. So peregrine falcon, highly ambitious, able to perform, capacity to achieve, high goal, high flying bird. Delusion, he is high as a bird. Delusion elevated in the air. Delusion enlarged, he is. Delusion division between him and others. Are you getting it? I am different from others. But what is happening to me? Again, antagonism with self. Remember, we talked about this rubric, antagonism with self, and the cause of autoimmunity. Ailments from abuse after being sexually. Now, again, I want to tell you, sexual abuse does not mean always sexual abuse. By sex, we mean male and female. Remember, females are put down, males are taken up. Okay, you're the male, you will go to work. She's a female, she'll sit at home. This is sexual abuse. Remember that. So don't take always the rubric elements from sexual abuse as sexual abuse. It could be a male and female discrimination also. So take this rubric. This is found in CPA also. CPA is also treated as a dark ship, or the ship which, okay, you're a girl, sit at home. Boy is supposed to work, earn money. Girl is supposed to see children at home, cook food, nothing else, and clean the house. This is what is sexual abuse. Remember, ailments from domination for a long time, humiliation, mortification, scorned being, anger suppressed, depersonalization, coming out from your body and talking to yourself is depersonalization. This is what these people do a lot. Remember that. And remember, falco P is made from the feather of the falcon, and this feather is of which falcon? Captivated falcon. A falcon which is being pulled down, kept in captivation for many days or many months, and then his feather is cut off, and then the blood is taken from that. So, can you imagine the whole emotion of the bird is coming in his blood of being captivated? That I am supposed to fly very, very high, but now I am captivated here. I am not allowed to do anything. I am just sitting on the ground when I am supposed to fly on the heights. Are you all getting it, this remedy? So you will see a lot of this nowadays. Captivated falcon peregrinus wing, ailments from domination, wants to fly high, but the interpersonal relation, that means the people surrounding in the family, they don't allow her. Power of the wings, flies above the crowds, made to sit at home in spite of so much power, known for its speeds, 350 kilometers per hour, naive, open like child, frivolous, libertinism, honest. So basically, they're very, very nice people, remember that. A sterling remedy for patients who feel constrained and dominated, especially by a parent or partner or even their own children. They may feel like a trapped wild animal, forced to do things against their instinct for survival, as if towered over by an overwhelming power that they are forced to obey. On the positive side, a lot of brightness, clear sightedness, focus is there, laughter is there, confidence is there, 12 noon modality, closeness to the nature, colors, all these things are there. Negative sign shows coldness, unfeeling, anger towards loved ones. There may be a perception of being pulled down, put down, humiliated, scorned, undervalued. Many times I could think of Hema Melis also. Remember, because Hema Melis also thinks that she is not respected enough. But the problem of Hema Melis is that she may be at a high post, but at home she may not be respected. Remember, but this is completely different. This person is pulled down and made captivated at home. So that is the difference between Hamamelis and Falco Paranus. Remember that. Delusion is a prisoner. Delusion is a prostitute. Delusion trapped, flying, rushing towards sky, can easily sacrifice for the family. And therefore the rubric is ease feeling off. They leave everything very, very easily. Can anybody leave a top 2 lakh or 4 lakh job so easily? Not many ladies would do that. They would say, I'll leave the husband rather than leaving my job. But this lady will leave everything very, very easily. So ease feeling off. Carcinosin does to please others, remember. Here she is not pleasing others. She is leaving because of the responsibility. That is the difference between carcinosin. So I was wrong when I gave carcinosin because it was giving partial response. But when I gave Falco P, immediately the response was very, very good. So these are the rubrics: delusion, prisoner, trapped, flying, repudiated by relatives. Again, just like argentum nitricum, remember, even Hura is there in repudiated by relatives. Domination, scorn, shame, ease feeling of, very, very important. Over 1 year, she was given few doses of carcinosin in LM potencies, but still she was only partially better, not completely better. Then I introduced Falcopine 30, and over 6 months, raising it to 200 and LM1, and she started feeling better. Gradually, her steroids and Misacol also tapered completely. Last follow up, her migraine was much, much better. No attacks now of bloody stools and pain in the stomach, in spite of new responsibilities. And now, somehow, the happy news was the husband has told her, why don't you go and start doing work? So this is what homeopathy does. The miracle of homeopathy is that not only the patient changes, but also the relatives they change. And the husband started telling her that, okay, I feel that it's high time that you are so much educated, you need to do something. That awareness was brought in the family, the whole. The remedy heals the whole family, remember. It does not heal only the patient, but the vibrations of the remedy, they heal the whole family, remember. So this is what I wanted to share with you today. This is yet another case of Graves' disease, but I think we are close to 3 minutes to closing. So maybe we can do it another next time. I got a lot of cases of autoimmune disorders, but this was something which I wanted to introduce a new remedy which could be very, very useful to all of us. So please use it in your practice and let me know. Okay. Thank you very much.
Thank you so much, Dr. Samir. It was wonderful. You have shared the causes of autoimmune diseases and introduced a remedy. And the class, the whole thing was wonderful, and really it helped us. Dr. Danesh is Danesh wanted to.
Hello, sir. How are you?
Yes, fine, fine. Good evening, Dr. Bhadra.
Good evening.
Dr. Samir. It's really a very good session with
You
you.
always call me Dr. Batra. I'm not Dr. Batra. I'm Dr. Samir. I'm working with Dr. Batra's academy.
Because your
Yeah.
name mentioned here is Dr. Bhadras.
Okay. No. It is actually my official laptop. Anyway. So I hope
Yes.
everybody liked it, and I would really like you to use this remedy more often and let me know how the results are. But as long as you now understand what are the causes of autoimmunity, try to look into this. Try to talk to your patients if they come before any autoimmune disorders and tell them to reverse all this, because once they go into this thought process, they might develop autoimmunity in the future. So prevent it before it comes.
Yes.
This is very, very important. Okay.
Yes,
Dr. Jolie also, Dr. Jolie, madam, please.
that the Falcon P patient's husband also has to be treated. Is it not? We have
Yeah,
to give medicine for that husband also because
no,
of that
madam. Yes, I agree with
medicine.
you that the husband should be treated, but it is how you perceive the problem. The thing is that not all ladies will become Falcon P, not all ladies will develop ulcerative colitis. This patient developed ulcerative colitis because she perceived her situation like this. Yes, her situation was like that, but she perceived it in a manner that she got the problem. Remember that. Any
Okay,
other
okay,
lady
okay.
would have perceived it another way and she may not have got the problem. Remember, she developed an autoimmune problem because she was in that particular state to receive this problem. Are you getting it? So husband,
Thank you, sir.
and
Thank
as
you.
I told you, husband did not require any treatment. Husband herself has started telling her that you need to go for work now. So our Falco not only act for the lady but also for her husband, isn't it?
But I'm thinking after eating the medicine, her attitude changed towards the family.
So the
So
way
that,
she perceived is was
yeah,
yeah.
before she was thinking it was
Exactly.
Anyway, now it is 9:30. Oh, Dr.
Oh,
Rampal,
Ram
thank you,
Pravesi.
thank you,
I will
thank
be
you,
taking the,
thank
okay.
you, Andini, and thank you, everyone. Good evening and congratulations,
Thank
Dr.
you. Thank you.
Batra.
Thank you, sir.
Very nice, very nice presentation. Very
Sure.
good
We'll see.
describe
We'll see you
the
all in Dubai. Whoever is in Dubai,
uh,
we are meeting on February
medicine,
in Dubai. Okay?
alco,
Yeah, yeah.
alco P and
Alco P.
carcinogen hemamilis.
Yeah, yeah.
Very good describe the medicine.
Chalo,
So very,
chalo. Bye,
very
bye.
nice.
Thank you
Yeah,
so much and bye bye
IFPH, very,
everyone.
very thanks whole team. Congratulations.
Thank you.
Thank
Thank you,
you.
sir.
Thank you so
Thank
much.
you, sir.
And Dr. Samir, you have to come again with the same cases. We are eager for the next classes.
Sure, sure, sure.
Thank you so much.
Okay.
And
Bye-bye.
love you all. Good
Take
night.
care.
We'll see you. Thank you
Thank
for
you.
your cooperation and participants.
Bye-bye.
Now we are moving to the Malayalam session. I am inviting Dr. Shaila, who is